Hello everyone, welcome to my channel. Today in this video, we will discuss a topic related to gastroesophageal reflux problem in newborns. Hope some of you have an idea about this, but just we will refresh the ideas, then we will move to the question. So let us start. The nurse is teaching the mother of a newborn about gastroesophageal reflux. What does the nurse suggest to help prevent reflux? Select all that apply. So I will reword the question. The question directly asks to us, what are some of the good suggestions or the instructions that should teach a mother of a newborn to prevent the gastroesophageal reflux? So what are the interventions that should carried out to prevent the gastroesophageal reflux in a newborn? So that is the question directly asked. Now we will move to the options. Option 1 says burping and after feeds. Engage baby in active play after feeding. Feed baby in sideline position. Hold baby upright 20 to 30 minutes after each feeding. Offer smaller but frequent feeds. Option 6, place baby on tummy after feeding. So we have 6 options here. And it is a select all that apply question. So we should have an idea about all the interventions to prevent the gastroesophageal reflux in newborn. So let us study some points related to that first. Then we'll come back to the question. What do you mean by gastroesophageal reflux? This is an attributed and immature lower esophageal sphincter. When the lower esophageal sphincter is immature, there is a chance to develop gastroesophageal reflux in the newborn. So that is the main point related to this one. So it is commonly seen in infants aged less than or equal to 3 months, and the result is there will be a spitting after feeds. If an infant is gaining weight and meeting the developmental milestones appropriate to the age, the treatment is aimed at controlling the symptoms. So that is a point you should keep in mind. If the infant is gaining adequate weight and the developmental milestones are appropriate to the age, the symptoms of gastroesophageal reflux will be aimed to control. So that is the treatment, control those symptoms. Because infants with the gastroesophageal reflux are at risk for aspiration and apnea. So caregivers should be instructed about the CPR, cardiopulmonary resuscitation. That is also very important. Because of the risk of aspiration and apnea, the caregivers should have an idea or they should get the instruction from the nurse regarding cardiopulmonary resuscitation. Then another point, burping the baby frequently helps expel the air before milk buildups over it. So whenever we are feeding, we should burp the baby in between so that the air will be come out. If there is milk over an air pocket, the milk will come up with the burp. So if there is air while doing the burping, it will come out. So there is no problem. So that is a good intervention the nurse or the mother should carry out to prevent the gastroesophageal reflux. Then the next point, holding the baby upright for 20 to 30 minutes after feeding allows gravity to assist in keeping the food in the stomach. See, which means after the feeding, at least 20 to 30 minutes, we should keep the baby upright. Should not involved in any active play or should not keep on the tummy or should not keep a sideline position. So if you keep in an upright position, this will help the food content will be in the stomach as based on the gravity, and the stomach will settle by that time. Then feeding the baby smaller but frequent feeds will be the best option. Very small quantity and more frequently. So that will increase the emptying and also will not create a more pressure or fullness in the stomach. Because if there is more pressure or fullness, there is a chance to increase the gastroesophageal reflux. And it's also ensured that the child is getting the acquired or the adequate amount. So these are some of the points related to the gastroesophageal reflex. So what are the points we studied? Burping should be done and should not give a too much amount at a time, very small and frequent feed, and should keep the baby at least 20 to 30 minutes after feeding, upright after feeding. Then should not keep the baby on tummy, and should not keep the baby on a car belt, a car seat, because that will increase the intra-abdominal pressure. And while we are keeping the baby on abdomen, that is also increase the pressure in the abdomen, so the food will come out, or the gastroesophageal reflex will increase. I hope the points that we discuss is clear. So what are the answers? Now you can see the answers in the slide. Option 1 is a correct answer, burping the baby. Then engage baby in active play after feeding. That is a wrong statement. We said that if we are doing such activity, that will exaggerate the symptoms of or aggravate the symptoms of gastroesophageal reflux. So should not do that one. So we should eliminate the option 2. Then feed the baby in sideline position, though that is not the correct method. Then hold the baby upright 20 to 30 minutes after each feeding. That is a correct statement. Then offer small and but more frequent feeds. That is very necessary, because it will not create a fullness in the stomach, and also the baby should get the adequate amount. They will not be vomiting or spitting of the feeds. Then place baby on tummy after feeding. That is an incorrect statement. So our answers are option 1, option 4 and option 5. Hope you understand why other 3 options are not correct. So if you understand it, please review the topic and study nicely. If you have any doubt, if you have any suggestion, please mention in the comment box. We'll discuss those points on the coming videos. Bye for now, and I wish you all the best for everyone.